Hello, and welcome to the Pulse of Manatee County on Manatee Educational Television. I'm your host, Dr. Srinivas Iyengar, an interventional cardiologist at the Braden Cardiology Center. Today, we are talking about the heart. Did you know 1 in 4 deaths in the U.S. is attributed to heart disease? With September being Heart Awareness Month, it's the perfect opportunity to stress the importance of a healthy heart. Today, we will talk about diet and exercise, but also being aware of symptoms that indicate possible heart disease. We will also cover new technology coming to a local hospital to help patients regain a healthy heart, as well as a great local event bringing awareness to heart health and research. Joining us today, we have Dr. Andrew Clark. Thank you for being here.
Thank you.
Who practices family medicine here in Bradenton. Also joining us, we have Paula Jefferson. Thank you for being here, Paula. Who is the director of the Heart and Vascular Imaging Center at Manatee Memorial Hospital. And from the American Heart Association, as well as Venice Regional Medical Center, we have Lee Goodman. Lee, thank you for being here. Well, thank you folks for all being here today. And so let's begin. One of the things that we always talk about with heart health is where to start. How does a person first get screened, or how do they first find out that they have heart disease? So Andy, let's start with you. When a patient comes to your office for the first time, what are some of the cardiovascular risk factors that you actually like to screen them for initially?
We kind of a little bit of variety of things. The nice thing is we kind of catch them at the front line per se, and so we look for things like hypertension, elevated blood pressure. We look for things like diabetes. We screen their blood sugars. We do a full panel on their blood work because we want to look for: do they have high cholesterol? Do they have high blood sugar? Do they have any other risk factors for heart disease, like do they smoke cigarettes? Are they overweight? Some things that we can help them with so they can make a full lifestyle change.
And that's really important that you say that lifestyle changes, which include losing weight and cigarette smoking, because we all know that is really prevalent in people who have heart disease. Now, Paula, obviously coming from a cardiac rehab background as well as directing the Heart and Vascular Imaging Center, you've worked with a number of cardiac patients for the last 20, 25 years, but specifically women. What can you tell us about how women present usually with heart symptoms?
Women have significantly different symptoms than the male. The male comes in with the crushing chest pain, the elephant sitting on their chest, and women at times just have a general malaise and they kind of ignore their symptoms. They have flu-like symptoms, just weakness, even dizziness, abdominal pains, and sometimes they wait longer to come to the emergency room than men. And so the American Heart Association has taken on a campaign to make women aware of these symptoms, and they're really out there educating the women on heart disease.
And that's really important because women should understand that though breast cancer gets a significant amount of awareness, shall we say, the heart disease is still the #1 killer of women in the U.S. And that's something that we need to tell patients about, that it's not just a male disease, it affects both, and it is the #1 killer for women. So they really should be aware that heart disease should be something that could be prevented and obviously treated if they have it. Lee, would you comment on a little bit about the American Heart Association events for September, or what actually is going on at this point?
Well, September 24th, we're having the Heart Walk. It starts at 7:30 in the morning. The Heart Walk starts. The walk itself starts at 8:30. You can come. We've got all of our vendors there that have participated in the Heart Walk before. You can get information about heart disease, blood pressure checks, blood sugar checks. Subway's providing sandwiches at the end of the walk. You know, the Heart Association has a lofty goal of by the year 2020 to reduce heart disease by 20% and to improve healthier lifestyles by another 20%.
And that's a really good thing to say that, because the fact is it's healthy lifestyle. Again, people have to understand, and I always repeat this phrase during this show, it's a positive mind, it's a positive body. And I know we talked previously in the show, when you see patients in the cardiac rehab center in Venice, if they're not positively motivated, do you see them succeed?
Well, I actually teach the emotional aspects of heart disease in that program. And if they don't get mentally healthy, no, they don't. The recovery usually takes about twice as long.
And that's amazing because, Paula, I know that you say the same thing in Manatee. When patients don't really feel motivated, they don't do well.
Exactly right. And so that's where you really need to focus on them, because you can form cardiac cripples. People become so afraid after they have a heart disease, they're afraid to exercise, and they are avoid doing a lot of things. And really what we need to do, we need to motivate them to get out there to exercise and things like that. So it's real important that we educate them.
And I do feel, Andy, in this way, do your patients confront you in the office sometimes saying, listen, I just don't feel after this heart attack or after a surgery for bypass, for that matter, that they can get back to their normal life?
Well, a lot of them are scared. A lot of them are scared. A lot of them are don't know what to do. That's where a lot of it comes down to. They come in, they want some information, and things are tough to give them the full time to be able to explain, this is how you lose weight. This is how you eat right. This is the cardiovascular, the exercise that you need to do on a daily basis. And a lot of people are under the assumption, if I exercised early in life, that I don't have to worry about it as I get older. But it doesn't stick like that. You've got to do it your whole life.
And the thing is, you know, you can change lifestyle, but you can't change your parents. Yeah. So we all know this. Genetics play a huge part in how you will end up eventually. So even if you run marathons, I've seen these patients end up having heart attacks. And the big question is why? Well, that's when family history comes into play. So obviously, it's not just about exercise and diet, it's about knowing your history, which would be pretty predominant in what's going on. Now, Andy, medications-wise, do you feel that a lot of these patients need to have their medications altered continuously after their, sort of say, heart issues are brought up?
Most definitely. And I think, you know, part of it is kind of explaining to them what's going on and seeing, hey, I'm going to give you a trial of doing something on your own. Let me see if you can do the right things, lifestyle modification, for you to get better on your own. Then when it comes down to it and they've tried that route and maybe they failed, or genetics played a role and they were unable to get their cholesterol down, their blood sugars down, they're more likely to jump into using a medicine. Yeah. And when they use the right medicines and the one that are a little bit more effective for them, then they seem to be happy with it.
And it's interesting because coming from a physician standpoint, we're commenting on medicines, but I think Lee and Paula can comment a little bit about the other side of life that we don't hear much about, because the patients are usually embarrassed to ask us. It's about regaining sexual activity after a heart attack. Now, Lee, Paula, patients have asked you during the rehab sessions when they're fit to regain to do those activities?
Absolutely. We get that question quite often, and it's I think when I first started doing rehab, it was interesting to see that happen. But they do. They're concerned. Mainly their partner is concerned. Their wife, husband is concerned that they don't want to stress the patient and make them have another heart attack or another,
exactly.
Another arrhythmia. So we go through and we do some education with them. We have some brochures and things we share with them.
And Paula, when you comment on that as well?
That is the truth. And a lot of times when I've talked to patients after they had a heart attack, the spouse takes you aside and asks you, you know, can they have sex again when? And they are afraid, and there is denial. And so that you need open communication in the couple. And with their doctor, you need to be able to make them feel comfortable that they can talk to their doctor about
Well,
that.
I do think there's something called white coat hypertension. I do believe there's some type of white coat paranoia too, because patients come in, they don't ask us as much unless we ask them directly. So I do think the comfort level, especially when you work in the rehab setting, because you're actually actively stressing them daily, it makes them feel, hey, maybe I can ask you what would be appropriate. But I do think that's interesting that you've mentioned that, because we are technically, a lot of times, we aren't asked that question in the office. So I want to tell patients who are watching this, or people who are at home, really, there's a number of people who can answer these questions, and they should feel open about talking about the subject.
And a lot of people feel embarrassed.
Exactly.
And there's no reason to feel embarrassed. It's a healthy part of a lifestyle. I mean, people enjoy it thoroughly.
It is a normal part of a lifestyle.
Yeah.
That's what we should really emphasize.
And people got to realize that they can still go back to normal lifestyles even after heart attacks and even after strokes and things like that, and there's a lot of things that can be prevented if they work hard.
True, absolutely. Now, Lee, what do you think would be the one thing that you've seen in your rehab with these patients? Is it more of the mindset, or is it the weight loss, the smoking? Which is the biggest factor that you've noticed to be the big hindrance in these patients?
Well, you know, smoking comes into a big play because people don't want to give that up. They're addicted. But, you know, we have some programs to help them get through that, whereas I think weight loss maybe turns out to be the biggest problem. And I think it's one of the hardest part for people is diet. After they want to go to the word diet, not the word lifestyle. And for me, that's a big issue. I try to teach a lifestyle. You know, you can still eat some of the things that you used to love, but not every single day of the week, and not in the portions that we tend to eat here in America. And that is a biggest struggle for them, because they all use the word cardboard with me. They feel like they only get to eat cardboard now, and that's not the truth. You know, it's just about changing your lifestyle and changing the volume that you eat.
And that is a great point. Portion sizing. I mean, literally, a lot of these major diet plans in this country that work aren't doing it because they're cutting out carbs completely or cutting out fat completely. They're just reducing the sizes of how much you eat. And that's exactly it. If you burn more than you take in, chances are you'll probably lose some weight. So actually exercising 30 minutes a day, 5 days a week is what the American Heart Association currently recommends. We'd like patients to work out more than that, but I think by having a reduced portion sizing when they eat is a very big part of this. Now, Paula, what do you think is the main attribute here?
I think it's moderation. People need to do things in moderation, and sometimes after they have a heart attack, they go in strict. They won't eat any fat. They'll just go on a strict diet, and they can't maintain that, and then they go to the opposite end of the spectrum. So I think we really have to make sure that they know that they can do things in moderation, and like exercise. After they do get on an exercise program, they'll take some unrealistic goal. So we have to make sure that they take something so it will be a lifestyle change and that they will be able to maintain, and so they will be successful in their goals.
Now, Andy, the thing is that have you found that with the medications with these patients, when they come in, a number of complaints I get are the medications are either expensive or they make me feel tired, lethargic. What is your goal usually? How do you explain to them that you're going to titrate medications or adjust it? What's your plan of action usually when they have those complaints?
Like I said, most of our patients, we've kind of already started the base of, we've done that diet, we've done the exercise, we've talked about how their metabolism is slowed down as they age, ways to increase it, ways to eat multiple small meals in the day instead of those 1 or 2 large meals that are the ones that really slow your metabolism down and don't allow you to lose the weight that you want to lose. And, you know, when we've already kind of started with the lifestyle modification and then you come in and introduce the medications, the people are kind of more on board. They're like, well, you know, I tried that route. It just unfortunately didn't work for me. So now let me try some medicines. And you got to work around them. Everybody's different. You know, we obviously don't have the perfect genetic code for every patient where we can swipe their card and say this medicine is going to work great for you, and this one's going to cause you to have diarrhea, or this one's going to cause you to be tired.
Absolutely agree.
So unfortunately, that's the frustrating part for patients sometimes, is sometimes it takes us a while to figure out what's the right regimen. But if they're on board, they're going to be more receptive.
True.
So.
Absolutely. And Andy, let's switch the subject a little bit. You also have a background in exercise medicine. Now, patients that come to your office and say, hey, listen, I want to start an exercise regimen, but I don't know I've never been screened for heart history or heart disease. What do you look for? What are the red flags that you usually look for in those patients?
Well, the obvious stuff, the chest pain with exercise, the passing out with exercise, the extreme shortness of breath when they exercise are some of the things that we look for initially of some problem areas. And then we look at the risk factors, obviously elevated blood pressure, diabetes, stuff along those lines. But people are under the misconception that if they have these medical diseases that they cannot exercise. And that's the biggest faux pas, I guess you could say, that's out there. You definitely can exercise. You just have to have the right regimen. You have to progress into it, not jump into a full crazy regimen of exercise hardcore and strict diet where you're going to last for 2 weeks or 4 weeks.
Exactly, and I think Paul has a good point. People tend to rebound. They tend to have the rubber band effect. They'll go on a crash diet and they'll run a ridiculous amount of miles or do as much exercise as they can and then rebound after they lose that transient weight. It's not permanent. You need to have a mindset, I think. Like Lee, you mentioned initially, you said you did talk to patients about the mental aspect. Can you comment a little more about that?
Well, we talk about, we go through the whole part about depression, and you kind of wonder whether depression came first or whether depression came after the heart event. But we kind of go through them. We talk about ways to communicate with your physician, because to me personally, that's one of the most important things, is to be able to go to your physician's office and have that open communication to get the help that you need. Second of all, our staff at Cardiac Rehab is there to help you through these things. And we talk about diet, we talk about medications, all their meds have been changed, they're tired. We talk about side effects and how they affect them mentally and what they can do by talking to their physician. Maybe there's other meds that the physician can switch them to help with that. So they're a little less nervous and excited about the whole situation, so they can just get a little more calm.
Well, that's the key, the reinforcement that things are going to get better. That don't worry, this number of people have gone through these procedures or have had these events happen, that with medical therapy, with confidence, with some type of push from people like ourselves working with them, that they can get better and they can get through this. And oftentimes I do have patients that are on some form of antidepressant initially after, say, bypass surgery or a heart attack, but eventually they potentially get off these medications. Why? Because we want them to get to the next level of back to their normal life. And the way to do that is by constantly instilling in them, this is a normal event that's just happened that we need to get you through, that you will actually be back to your baseline with the correct support system. Now, cardiac rehab has been shown to, quite honestly, to be very effective in these patients. Have you, Lee and Paula, have you noticed that patients that have gone to cardiac rehab that have done very well fall off once they leave cardiac rehab?
Some yes and some no. You've got a majority that continue to exercise. You see them in the community. They tell you their accomplishments. Some lose weight, some don't lose weight. But they're willing to tell you what went on. A lot of them still stop by rehab to thank you and say, we're still exercising, we're still eating right. And then there's a group that just kind of falls off. They don't want to exercise anymore. They've done cardiac rehab and they're basically finished.
And there are some that come to cardiac rehab and then they're afraid to get out of rehab. They want to stay and stay and stay after they have that comfort level in there. And I think one of the things that we haven't mentioned was stress. And everybody has stress in their life, but how they react to stress. And so we need to educate people on their reactions. Some things they can't change and they'll just have to accept it instead of getting all worked up about the issue. So I think that's an important thing, is how they react to stress in their lives.
Paul, that's a good point. I mean, that comes down to the whole addiction. We have the classic nicotine addiction and the drug addiction, but then we actually have food addiction, and people don't think about that. And food addiction is probably one of the toughest things. So what do? They're stressed out, so they eat. And they eat and eat and eat, and then they gain the weight, and then they're even more depressed because they gain the weight.
And then when we push smoking against them, what do when they stop smoking? They eat more tendently. So we have
substitute.
Exactly as another oral substitute for them to use. And in the sense, gaining weight, obviously they eat the wrong things most of the time too, which would be salt or sugary foods, which is obviously we want them to avoid that in the first place.
Exactly.
So Angie, other than that though, when you see these patients come in with that type of mindset, do you give them a diet plan or refer them to a dietitian? How do you usually go about that?
Kind of depends on the patient. Some people I think are willing to go to a dietitian. Some people are willing to work with you if you can sit down and give them a little bit of time. And it's a repetitive thing. You can't just say, here's your diet, I'll see you in a year. If you do that, they're not going to lose weight. So we're big on giving you goals. Here's your goal. I want you to lose 10 pounds in 3 months or 5 pounds in 3 months. And then when they come back, they're like, wow, I hit my goal, or wow, I needed to work a little bit harder. And obviously with the whole food addiction process that we have, the biggest problem is fast food. And so, they walk in and they say, well, I want to lose the weight, and they have a big McDonald's cup beside you, they're probably not working as hard as you think they might be. But if you consistently stick with them and tell them this is something we're going to do together, not something that I'm going to yell at you every time you come in the office, then they're more responsive.
And I agree with you. By being less confrontational with the patient, though there's times where we need to be confrontational about the smoking issues especially, but the patient doesn't want to be scolded every time they come in. I do believe you're right, that a patient should come to the office and talk honestly. And the fact is that we all know this, fast food is cheaper than any type of other medicine that's available. And the fact that it is so cheap and it gives you a significant amount of calories, it's hard for people to break that habit. So it's almost difficult to say to a patient, eat less salt, eat less cholesterol, but you're going to pay 3 times as much at the Whole Foods store or some other place to get it. So we have to think of alternatives. And I think, Lee, you had a great point about stating portion sizing. So no supersizing, portion sizing.
Yeah, you're talking about stress. Stress in our society is a big piece that plays in. It's also that fast-paced lifestyle that we have that leads us towards the fast food. So we have to start coming up with plans that we carry things in the car with us that we can use as snacks instead of going through the drive-through, carrying things to work with us instead of going out and running to the fast food restaurant real quick. It's just about planning your life out. And we do that in cardiac rehab. We help you kind of work through your life if you're still working, if you're retired, so that you can function.
And that's good, because if you have something like that, like almost like a release, or shall we say a life jacket in that sense, that you don't have to stop at that McDonald's or that Burger King and get that quick fix. And that's literally what it is, an addiction and a quick fix of that sort.
And it comes down to time too. A lot of people think, I don't have time to do exercise. Right. I don't have time to eat. I'm in the car 24 hours a day, or I'm a truck driver, or I'm whatever it is. But if you explain to them, well, here, bring a couple bags of snacks, set your proportion size early. If you buy fruit, put it in a little small bag. If you buy nuts or peanuts or something, put it in a small bag, and then you have that proportion size already set, so you can't overeat. And then it comes down to, I don't have time for exercise. That's what most people say.
True, absolutely.
And you got to find the time, unfortunately. All of us have crazy lifestyles too, and we fit our time in the best we can.
It's also good if you can include the family members to get that support. So if the family member smokes, if you include them on the smoking cessations, if you include them on the diet plan, or if someone has a partner that they can exercise, people are more successful with it. So it's always nice if you can include important people.
Definitely.
The difficulty is when you have a family member, and I think all of you have probably experiences, that family that smokes or eats bad or has a bad lifestyle, shall we say. How do you guys deal with that normally?
Sometimes we try to get the family member in and talk to them a little bit. Sometimes that's tough, especially if they're not one of your patients or refuse to come in. But sometimes you're just talking to the patient about, hey, if you make these changes, maybe they'll make these changes. And if you make the changes together, then you're going to be healthy. You're going to have a long life together. You're going to be able to be around for your kids as they age. I mean, some important things that kind of hit home. And the kid thing always hits home. I mean, these people, as a father myself, I want to be around for my kids as long as I can. And I think these people understand that as well. So if you say, hey, if you want to live extra years of your life, you got to be healthy.
That's true, and I think that partner support always wins out at the end. If you have someone who works with you as opposed to against you, you'll have a chance to be as successful or much higher.
Most definitely.
Paula, do you agree with that as well?
I really agree with that, and so that's why in cardiac rehab we always try to include either their spouse, their partner, or some children, to include them to engage there in their lifestyle changes.
Well, that's great. And Lee, tell me about smoking now. What have you used or what have you seen work in the past to have people quit smoking?
Well, we use smoking cessation. We have a couple accredited through the American Heart Association for teaching smoking cessation. We actually have all the hospitals in the Sarasota County. I was on the committee that took every hospital smoke-free campus. So we offered Chantix to all of our employees to help get them off of it, and I've seen Chantix work very well. That's a great option. So, there's many options out there. You need to sit down with your physician and be able to talk through it. If you really want to quit, they can help you get there.
That's true, and I've actually seen patients respond to Chantix, to acupuncture, to a number of different therapies that are not really, maybe not even traditional, but they've done well. And that's key, is that they actually give up the smoking, because that's critical, as we all know, in the long run.
Yeah, and I mean, it also helps. There are some antidepressants that help. Sometimes that's the crutch. The big thing with it is the patient's got to want to quit. Because for all the patients that I've seen, if they don't want to quit, they're not going to quit. So motivating them to say, if you're going to start the Chantix, if you're going to start a smoking cessation program, you got to be ready to go. Exactly. You got to bring at least 80 to 90% if you're going to get that last 10%.
It's like that positive mind, positive body. Like we just discussed that. It's important, because if your mindset isn't there, I don't care how good we tell you it's going to be for you. If you're not going to do it, it's not going to happen.
Exactly.
Now, Paula, have you noticed that any patients specifically have quit smoking but felt that they've had to go back to it because of stressors or any sort of situation like that?
Well, one of the things I always tell my patients when they come in or having a heart attack and they come in and we ask them, do you smoke? And if they say yes, I always say, if you continue, I'll see you again in the cath lab. So, and then they usually say, I'm not going to smoke, I'm not going to smoke, and then they will smoke, and I do see them again. And so they really need a lot of encouragement, and that is tough. And you need to include the whole family in that, because a lot of time they're smoking families. It's not just one spouse or the other, and so it's tough.
And it amazes me too, because the cost of cigarettes is
so
expensive, and yet
pricey.
Yeah.
Amazing that they can still afford to buy the cigarettes, and the medications obviously get put on the back burner. And that's another reason why it's a pet peeve for me personally, because cigarettes are so expensive, and yet medications, they say, oftentimes patients say we can't afford it because of X, Y, and Z reason, but really, if they cut the cigarettes out, there's a chance that they could actually get the right medications for them.
And people get confused too. They always tell me, the number one thing people tell me is, I have to have my cigarette, it calms me down. That doesn't make sense. It's nicotine. Nicotine's a stimulant, so it's going to make you more wired. So basically what happens, you smoke it, you calm down, and then you get that rebound wired feeling, and all of a sudden you need another one. That's how the addiction happens.
And there is nothing positive about cigarette smoking. There's nothing cool, sexy, nothing of that sort that's associated with it anymore. Yeah. So it's one of those things where I can clearly say 100%, stop it. There's really no positive at all to do it.
But Dr. Iyengar, more and more young people are smoking again. Yeah. So I think we need to really start educating in high schools or in elementary schools about heart disease doesn't start when you're 40 years old. That's a progression. It starts at younger ages. So really the education needs to be out there in the school systems now.
And Paul, that's a great point. And Lee, are you seeing patients that are younger in your cardiac rehab, out of curiosity?
We are. Our population doesn't really push towards that. I mean, we've got a more retired community where we are. So yeah, but we are seeing it. I'll tell you, we do a free screening for the high school every year. Mm-hmm. And the amount of high blood pressure that we actually see throughout the high school students, we had one young man come in eating 10 cheeseburgers from McDonald's on his way in to get his physical. So, I mean, he wasn't overweight, he was in great shape, he was on the football team, but the blood pressure, I would say 50% of them were either borderline or had high blood pressure, and this is 10th, 11th, and 12th graders.
And I will almost put money that a number of those people probably have high blood sugar too. Because if someone's eating that many cheeseburgers a day and that young, chances are we're seeing diabetes now at a much younger age. And Paula, it comes to your point. We're seeing these vending machines in these school cafeterias or these school areas. They're just filled with junk.
Machines.
They're filled with nothing but junk. But yet, if the student doesn't have the money to buy a healthy food, it's going to go right to that. Now, Andy, have you seen that now in your office as well?
The other thing is some people think that there's no way they're going to have high blood pressure and high cholesterol if they're not overweight. Well, that's a big misconception because there's a lot of people that eat very poorly, are skinny, but have clogged arteries.
Exactly,
So.
absolutely. And genetics play a huge part in that as well. If you have a bad family history, or shall we say a significant family history for heart disease, you could be ideal body weight and still have the genetic predisposition for developing blocked arteries.
And Paula had a good point. I mean, childhood obesity is going up. So we've got to do something about it. And so obviously a good exercise regimen, a good screening regimen to try to get these younger kids going early are going to prevent us from having a large influx of heart attacks, high blood pressure, high cholesterol, and diabetes.
And I think that people watching this should really understand that we're trying to prevent the future bankruptcy of the medical system as it is right now. Because if we can change lifestyle habits at a person that's 8, 10, 12, 14 years old, potentially we can avoid a heart attack 20, 30 years down the line. Right now, we're dealing with a situation that it's almost becoming epidemic, seeing these young children growing up into heart disease patients later down the road.
Yeah, it's these sedentary lifestyles of these children. The parents are busy, both parents work, they come home, they have to cook dinner, and it's easy to have your kids go play a game, a video game or something like that, so they're safe, they're in their house, but...
Well, folks, I've got to get some closing comments. It's been a great panel today. Lee, any final comments?
I'd just like to ask everybody to come out to the Heart Walk. You can participate, you can come out and walk, you can donate, find a family, some friends that are actually involved in the walk, have a team, start your own team. Come into Subway. Subway's a national sponsor. You can go in there and buy a red heart, and all that money in this local area goes to the Heart Walk. It's www.SarasotaManateeHeartWalk.org.
Perfect. All right, Lee.
Give you all the information you need.
Paula?
And I want to just point out to the women to take care of yourself, live a healthy lifestyle, know the symptoms, and talk to your doctors.
And Andrew?
And the big thing is get screened. No matter how young you are, see your physician. The physicians aren't going to bite you. They're not going to hurt you. They're here to help you. And our goal is to just make sure everyone has a healthy lifestyle down the road. And you show up, we're going to do the best we can to try to make you feel more comfortable and try to explain things and try to catch things early so they don't turn into bad chronic conditions down the road.
Absolutely. Thank you guys for being here, and I'd like to thank you for all our guests for joining us today. This month is a great time to be aware of your heart health and make some simple lifestyle changes. Your heart will thank you. If you would like more information about anything we discussed here today, please find us on Facebook by searching Bradenton Cardiology Center, or for me personally, Dr. Iyengar. Thanks for tuning in to the Pulse of Manatee County, where we bring you up to speed on the latest in treatment and care and information on how to keep a healthy heart. Thanks to our guests for joining us today. Remember, a positive mind leads to a positive body. Tune in next time for the Pulse of Manatee.